So it's a pleasure to have with us today Professor John Cochrane from the Hoover Institute, where he's a senior fellow. And let's continue our conversations on COVID-19 pandemic. So John, you've been talking about pandemics for a while. I remember seeing some posts you had years ago on how that would be a much bigger shock than some of the things that governments like to talk about. So, how long have you been thinking about that? And was that just an example of something that governments were not prepared for? Or did you really think of that seriously before? And why is that? Why is that something as consequential as this that we're living through right now? It seems that every single Western economy was not at all prepared to deal with, or a Western government was not at all prepared to deal with.
Yeah, that's a deep question. So I'll, like all interviewers, like all of your interviewers, I think there's a bias towards, see, I told you all along.
I want to give you that opportunity.
Bias. Sorry? Yeah. There's a lot of chance for retrospective bias here. Certainly, and I have to say, so I'm not a researcher in this area. I value real scientific peer-reviewed researcher. I'm a blogger. I run the Grumpy Economist blog, an op-ed writer, a pundit, a public intellectual maybe. But that's been my role in thinking about these things. With that disclaimer, really as part of the climate, there is a genuine climate science, and then there's a climate hysteria. And in thinking about that, there were people saying, what's the gravest danger facing Western civilization? And as I started putting together my lists 10 years ago of what are the greatest dangers facing Western civilization, it struck me that pandemics ought to be really high on that list. Especially, historically, every wave of globalization has led to a pandemic, from the 6th century in the Roman Empire to the plagues of the 1300s in Europe, which followed the opening to the East. Of course, I think the worst pandemic in terms of fraction of the population killed has to have been the Columbian, what are you supposed to call it these days? Not the discovery of America, that's for sure.
The Columbian Exchange.
Yeah, that book 1491 really struck me about the Columbian Exchange. We gave them smallpox. They gave us corn, we gave them smallpox. Like 90% of the population died and wiped out civilizations. And I don't want to go on. 1918 was obviously a similar case. So pandemic, nuclear war, civil unrest, regular war, crop failure. There's a whole lot of things that struck me as dangers to Western civilization. And because they come unexpectedly, unpreparedly, in a way that climate comes very slowly, any healthy society ought to be able to figure out climate. It takes 100 years to come along. So I've been thinking about it a long time. And I'll just say, as we're still on background, in a way, I think we're extraordinarily lucky. Societies are never prepared for tail events. This virus is perfectly designed to get our attention without killing an enormous fraction of the population. There is nothing in the biology that says a virus like this can't kill 10, 20, 30, the bubonic plague, 50% of the population. We got just enough to scare us and wake us up, I dearly hope. Now, yes, as you said, everyone was completely unprepared. So that turns out to be false, as I've now done a little more research in it. Our leaders were smart. George Bush read a novel about pandemics, and there's a beautiful pandemic response plan with PowerPoints and pretty pictures and all the rest of it. It turns out, and this is stuff, if your readers are curious, it's somewhere on my blog, there's like 12, 20 beautiful pandemic response plans from Health and Human Services and the Department of Defense, who worries about bioterrorism. That's one where bioterrorism, a designed virus. Imagine how open we are to that. And the one interesting fact of all of these is none of them cites the others, which tells you about how much effect they've had. So what you need in this case is public health, which is a local, detailed thing. And the same way schools have fire drills. They don't have a manual down in central administration what to do in case of fire. They have fire drills where the kids have to go out and practice, getting ready. To stop a pandemic by public health means, testing, tracing, that sort of thing, you need a bureaucracy ready to go. And that's that low-level, well-trained bureaucracy, connecting the grand plans to a readiness on the ground is what we obviously didn't have anywhere in the Western world. So don't start
not
in
a
on
U.S. specific thing.
and all the rest of us. Pretty much every Western country resorted to. Here's what I'm worried about, and then I'll stop. Economic lockdown should be it's a panic button. It's that this is totally out of control. There should be a public health response where you find sick people and stop it from spreading. Not everybody has to stay home and we crater the economy for a while. Okay.
All right. So then let's talk about this specific one and go back to early February, maybe late February, early March, where news start coming out. We start getting worried about this. Maybe some people were worried about this before, but honestly, I have to confess that I wasn't. I was thinking, oh, it's another one of those SARS things that happened a few years back. Mostly, it's going to be contained in Asia. And then we start seeing Italy happening. And clearly by early March, I think everybody was really aware of the dangers coming our way. So how were you approaching the problem then? What kind of data or information you're looking at or models you're looking at to sort of inform your thinking in preparing to evaluate the types of ideas putting forward?
So I'm going to comment a little more generally first. You're exactly right. And it is it's a feature, a common feature historically, and there's some blog post here that covered this thing. The way public authorities respond to pandemics has never changed through history. And the first response is, well, we don't want to scare people. Because most of the time, there's a lot of false positives. Most of the time, it's like SARS, it comes and goes. If you shut down the economy, they say, you got to be kidding, what a joke that was. So certainly our public officials, there's a lot of 2020 hindsight among public officials. Oh, you should have closed it down 3 days earlier and so on and so forth. But that is just a feature of the way things work, which is why I think you need a well-oiled, low-level bureaucracy that handles this stuff automatically rather than relying on presidential decisions. I just read the news, and in February, the news was fairly apocalyptic, but I sort of have an open mind too. The news was apocalyptic, but we economists, we know one thing: we have a lot of experience with complicated computer models, and that is one thing that makes me I don't want to say skeptic because that's a loaded word, a judicious evaluator of climate projections. In economics, there was the Club of Rome that forecasted in 1972 we would run out of resources. The planet would fizzle by the 1980s. Keynesian macroeconomic forecasting and policy evaluation models fell to absolute pieces in about 1978 and have not come back. So we know something about forecasting model, big black box forecasting models going wrong. So yes, the models at the time, the infamous model from the United Kingdom that was forecasting horrible stuff, that looked pretty terrible. 2% death rates at the time, uncontrolled sweep through the population. You multiply 2% times a lot of people. And certainly I was extremely worried about it, as was anybody paying attention at the time.
So that was about, projecting something like 2.2 million deaths in the US, about 500,000 deaths in the UK. And that was the sort of, perhaps unfair to look at those numbers only in the context of that report, in the sense that that might be the worst case scenario. But then we start planning based on worst case at that point in time. So
well, you want to place, but so like you, boy, I saw that and wow, did I really believe it? The logic was, you multiply 2% death rates by it sweeps to the population, and it's hard to argue. Now, it turns out to have been largely wrong, which is an interesting thing we'll get to. But like you, I look back at myself. I actually took a trip to London in early March. I look back saying, what was I thinking?
You could have been stuck in quarantine somewhere.
Years old. So we do all. There's two kinds of human psychology. One that jump, the Chicken Little, the world is always, the sky is always falling, and the other kind that's slow to respond to danger. I'm in the slow to respond type as well.
But okay, so we're looking at the dire predictions at that point, and I think California was where you live was one of the few early states to say we have a shelter-in-place order. where everything has to be shut down before any other measure was tried in some capacity, right? So that was the first reaction of your governor, and we're still under the order 2.5 months later, if not more.
Unless you want to go pick up some free stuff down at the local stores, but yes.
That's right. That's right. So at that point, I mean, as an economist, you are thinking, all right, so on the one hand, I have 2.5, I don't know, let's say, take the proportion of those deaths in California as one outcome. On the other hand, the shelter-in-place order has its impacts.
So I would have to, I should have prepared for this by looking back at the dates of my various blog posts and op-eds. I do want to congratulate myself. I think I was about 2 weeks ahead of consensus opinion on a couple of these occasions. As the shutdowns were coming, I was kind of, as an economist, I was pulling my hair out that it seemed such a sledgehammer blanket problem. I think I was advocating shutdown smart. Just take a little bit of thought about what kind of activities are dangerous and what kind of activities are not dangerous. And rather than business is bad, shut down all business, try to come up with at least, well, except they had the essential business versus the non-essential business. Essential in California, I looked up the list, included construction of affordable, quote, affordable housing. Non-essential included golf courses where you're completely unlikely to get it. So at least I was praying for some sort of smart policy. The trouble is, what this reveals is just the astonishing lack of bureaucratic capacity that we have in the US to make any sort of judgment about how much danger to virus versus how much GDP or how many jobs are because that's what you want. You want to get the reproduction rate under 1 at a minimal cost of GDP. That means you got to think about what you shut down and what you don't shut down, and just think about some. Only now is there vaguely some recommendations. Okay, you can reopen, but stay 6 feet away from each other and so forth. This took 2 months to put together. So I do think I was at the time in the shutdown smart, and not just business. Let's, birthday parties are the problem. So let's have some recommendation. Plus, boy, it would be nice to use some sort of data. Places. I go out to some of the wilds of the Central Valley for various hobby activities, and there's no coronavirus out there. So just some basic, how bad is it where you are? What are the dangers? What kind of businesses can operate? What kind of businesses can't operate? Would have been, boy, we could have done this with a lot. Even knowing what we knew at the time, I think we could have done this with much less hit to GDP.
Yeah, it is surprising to me that conversation was just not had. I mean, I remember you talking about that, and I remember using some of your. We talked actually early during this time, and I was helping some folks here in Texas, and we put together very quickly a measure of risk that's based on some labor department surveys on how often do you get close to somebody, how often you're in a car with 5 people or more of different activities. And we could break down very quickly, okay, activities versus employment versus GDP contribution. Just stare at that picture as a simple, as a finance professor, that looks just like an efficient frontier type discussion, right? And it's obvious and it's simple, but it went nowhere. It went nowhere, and the things that we put forward, people just had this notion of shut everything down, don't worry about any cost, and let's wait. So yeah, I was very concerned at that point in time, and still am, in the sense that I think that that tool are still being considered for a potential second wave.
In the US, we do seem to, once we've done something once, then our need to justify ourselves means that that's what we do forever and ever.
Right.
So I worry that the lesson that I hope we would learn out of this, we need a robust, detailed, data-driven public health team ready to go and keep it going. California had mobile hospitals that have put together at great cost after the SARS epidemic, and our governor, Jerry Brown, cut them in order to save $5 million a year on the budget in favor of his $80 billion high-speed train. So you got to not just you got to keep it going during the years when nothing's happening. But that instead of that, we will learn the lesson. Okay, we're ready to go. Economic shutdowns. Here we go again.
Right.
In the same way that financially we're replaying 2008 as if that was the perfect response.
So when we're thinking about the costs associated with shutdown, there's the obvious things about, okay, production is halted. That means, I don't know, I think at some point the estimates are, it depends on who you look at, but $1 trillion a month seems to be a reasonable number of the economy stopping. I think Casey Mulligan has put the number at $7 trillion over a span of a year. What you were looking at this week, I think the number of coming out of 50% contraction in the second quarter is a possibility. I think Hassett was putting these numbers out of the White House yesterday. But those are you can think about that as being a short-term thing of like a long extended vacation. And we all stopped for 2 weeks, a month, and that's it, fine, we're back. And sure, we forego the production and the money that's generated in that month or so, but then it's back up. It's just not quite like that, right?
Yeah, and here again, so I'm glad you're forcing me to come to terms with my own forecast, but I think I did fairly well on this one. My first op-ed on the subject very early on was thinking about the economic costs. And your first instinct as an economist is, look, this is supply, not demand. This is just the great vacation. We do this all the time. Over the Christmas holiday, all production shuts down and starts up again January 2nd as if nothing happened. Well, let's just take one break here. I have some background noise here. Is that coming through to you? Because I can close windows and stuff.
No.
Okay. So let's see if I can take up where we're at. Maybe I'll just start from scratch. Sorry?
You're talking about supply shock.
So as this started, the first economic impulse is to say this is a supply shock. We're shutting down businesses, but we shut down businesses every year from Christmas to New Year's and come right back January 2nd. Actually, it looks to me like we shut down businesses about Halloween to New Year's in the US. Now, so that argues for the V-shaped recovery. Why isn't that going to happen? Well, first of all, we weren't prepared for it. Everyone keeps enough savings around to get through there, and businesses know that they're not going to be people coming in during vacations. But the big problem is this goes on for months. It's unexpected, and Americans are once again up to their necks, up to the gills in debt. If not all Americans, but many are. Restaurants, they can't keep paying their bills for months on end with nothing coming in. And all business is that way. Once again, most businesses going into this highly leveraged. And that means that a long total shutdown of this magnitude, even in the Great Recession, we didn't go to zero. You might have lost 10, 20% of your business. You didn't lose everything for months on end. So that could lead to a wave of bankruptcies. Now, bankruptcy isn't the end of the world, especially if you're a big corporation like an airline, but it leads to liquidation more often than not for small businesses. And, people's homes could get foreclosed. And so the danger is that a pandemic turns into a financial crisis, and then the businesses just aren't there to reopen when you get going again. So that, I think, was the central economic problem to worry about. Isn't it not? A month or two of terrible output and that's to be expected. You shut everything down. The question is, are people who are reporting unemployed, are they really unemployed, or are they just waiting for their companies to call them back? Well, if the company's still there, the company can call them back. If the company's not there anymore, that's going to be harder. And the longer this goes on, I think the longer those adjustments are going to have. It just takes much longer to find a new job than it does to go back to your old job. So those are, and you were asking retrospectively. I think that was my first op-ed, that this is the danger, and trying to think hard about how do we do that? How do we get through that problem? And
outside of economics, were you thinking about any other costs that were not being openly discussed about the shutdown?
Privately, sure, but I try to keep my public comments to economics. There's a lot of discussion now about you're saving one kind of health at the expense of all sorts of other kinds of health. I've stayed away from that because I don't think it's that salient, and I'm not really an expert on which kinds of health you do. I don't have anything special to say about that.
It does strike me as like one of the things that we try to do is to flatten the curve so we don't overwhelm the hospitals. So what we do instead is shut down the hospitals for 2 months. the logic of that is just flawless to me.
Well,
it's not quite like that. I get it, but
there's this really interesting thing that happened. So we learned that the demand curve for medicine does slope down after all.
Exactly. Turns out.
So everyone thought hospitals would be overwhelmed. In fact, it turns out hospitals weren't overwhelmed even with COVID patients, except in New York. And everybody stayed home from all their minor stuff, and so hospitals are in about as bad financial shape as restaurants. In particular, we have this system, as you know, you and I have talked about this otherwise. Our monstrously dysfunctional health system relies on cross subsidies from paying customers for elective surgeries in order to pay for emergency room treatment. So all of the paying customers who used to be footing the bill for everything have disappeared for a while.
Right. I am disappointed a little bit on the economics profession during that time. I think that there's been a lot of great work. The economists jumped into the retool and think about the infectious models, given that their knowledge, as you pointed out before, they have knowledge on those those computer models based on ODEs and so on. So it's not that different from the tool set. And it's great. There's a lot of great work being done there. But what I thought was lacking in the discussion early on from economists, labor economists, for example, is to talk about the impact of shutting down our schools for 2 months, the long run impacts of that, and just very little consideration of that given, and maybe, you know, in the very first instinct of a 2-week break to figure out what to do and so on. But once we realized that no schools open since March across the entire country.
The other thing I think I'll fault our economists friends on, we still live in this advice for the benevolent planner mode. And we also assume that benevolent planner has a detailed bureaucratic capacity to implement things. We don't study regulation anywhere near enough. I think in part because there's a lot of anecdote, but not a lot of data easily available. But the story of this has really been the story of catastrophic failures of the low-level regulatory agencies. The FDA refusing to certify plants where people want to, you know, the greatest economy on earth cannot, in a matter of months, produce 50-cent plastic face masks. Are you kidding me? Well, the FDA won't certify your plant. It has to be, you can't use a paint face mask. It has to be certified in the ones that are China's selling to the European Union are only certified for European Union. They're not certified for the US. The CDC bungling on the testing was just remarkable. And as we talked about, the inability of our governments to do anything other than just everybody stay at home except for whatever we deem essential. And even then, the essential workers, you know, the ambulance drivers weren't wearing face masks for the longest time. You know, at least a minimum of thinking about it. Now, to your point, so economists have been great. You sit around the lunchroom, and we're full of these great, clever ideas. Oh, well, we should just separate the vulnerable people and let it spread, and all this stuff. But just the bluntness of the regulatory tools compared to the cleverness of our models is something that I think we need to pay more attention to.
All right, so let's fast forward to now, given what we learned now. So in early March, maybe there was scary news that we were thinking of this being different than what we know right now. How have you updated your understanding of the severity of this? Are there any particular models or information that currently gives you a better understanding, or where you are right now? And this is, by the way, just for the video, this is June 3rd here that we're talking.
Yeah, so here's really where we get dangerous, because I'll offer a forecast that will undoubtedly be wrong.
No, before the forecast, just given what has updated your view on this?
So my own thinking and my reading, I think I've learned a couple things. We've all learned the death rate is much lower among young, healthy people than we thought. Vast majority of the deaths are among old people, like half are in nursing homes. We have learned that the SIR models were fundamentally wrong. So the basic model, and this is easy to understand, a virus spreads exponentially. I give it to 2 people, he gives it to 2 people, they give it to 2 people, and so forth, until it runs into some force that slows it down. The basic model said the only force that slows it down is the people you're running into have already gotten it and they're immune. And that's the herd immunity idea. Well, it turns out the force that slows down the reproduction of the virus is people aren't total morons, and even their governments aren't total morons. They change their behavior so they don't give it to as many people. So I and many economists started exploring what we call behavioral SIR models, where the limiting factor is not that you run into people who've already had it. You're still in a situation where most people haven't had it. But the limiting factor is changes in behavior, economically costly changes in behavior that limit the spread of the disease. My little model on that was very interesting to me. It always settles out at a reproduction rate of 1. Now the reproduction rate's the key parameter here. If the reproduction rate's less than 1, it goes away. If the reproduction rate's greater than 1, it gets bigger. And so the number one goal is get the reproduction rate below 1. But if people pay more attention to it when there's more of it around and less attention when there's less of it around, then the reproduction rate just settles to 1 kind of always. So that was an interesting, my little behavioral SIR model. That led me to think that what's going to happen is not a massive second wave where everything they were forecasting in February comes back in the fall, but instead this just trundles along with a reproduction rate around, wiggles, embers come, embers get put out, people pay more and less attention. And then as we learn more about the disease and people are able to take more care at less economic cost, then the total number of infections slowly dies away. So I'll put that on. That's my forecast. There's good news. The good news is I don't think we're primed for a huge second wave that does kill the millions of people that they were forecasting. They keep saying, well, it's coming. The bad news is that until there is really good testing, tracing, and the bureaucratic capacity to do something with the testing and tracing, that's the main thing missing. We have the tests, we just, our bureaucracies don't know what to do with test results. They're now thinking, oh, we need to hire some contact tracers, don't we? Well, that would have been a nice idea 6 months ago. So anyway, that thought leads me to think that we're going to be living with this at low level for quite some time. The second thing I've learned is the importance of super spreaders, heterogeneity. Economists, this is behavior and heterogeneity. Boy, what are the two biggest things that economists think about?
Let me point out one thing. I think when you say a behavioral model, I think some people will think about, it's a rational model, right? It's a rational model that takes into account behavior. It's not a behavior as some behavior economic models are. Just
yeah, I'm really sad that the behaviorists got to steal a perfectly good term. We are all behavioral economists. We study human behavior. We write down models of human behavior, and then we see if those models work. That's what I meant by behavior, as opposed to mechanical. Diseases do not spread in humans the way they spread in rats, because humans understand there's a disease out there. Thank you for the terminological correction. The second most really important thing is the importance of super spreaders. And you've heard the stories, cruise ships, nursing homes, meatpacking plants, birthday parties, weddings, choir practice. This thing is spread most in situations where a fairly large number of people is indoors together for quite some time, and they're talking or singing. And therefore, it's not just droplets that go from one person to another, but little aerosols that spread through a room. Now, why does that matter? All tails are fat tails. And if our goal is to get the aggregate reproduction rate below 1, it does not help much to take an economist whose reproduction possibility is like 0.5 and make his 0.4. What matters is getting a hold of these super spreader events where one person gives it to 70. If you can just stop that, you get the aggregate reproduction rate below 1. And the best part about it, most of those things don't contribute a lot of GDP. Meatpacking plants are kind of, that's a hard one, but birthday parties, choir practices, stuff like that, that is the central activity. So the good news on that is that I think there is a way for this that the behavioral response can be both government and individual. Just avoid these super spreading nuclei. Now that doesn't mean there's a difference between public and private health. You can still get it by contact with one person, but from a public health point of view, all you got to do is stop the super spreading activities, and the thing will go away. So those two, I'll now put my forecast chips on it. I think this will trundle along with us for a long time without a huge second wave. And I think that part of the reason is we're not that dumb. We're not going to put COVID patients back into nursing homes again. No one's going to be that dumb to do that again. We're going to take precautions at meatpacking plants. Now, here, my faith in human rationality is a little bit unsettled. I wrote an op-ed just before Memorial Day saying people aren't dumb. They're not going to go congregate in places where you can have a super spreading activity. And then Memorial Day weekend came along, and there were the pictures of all the crowds on the beach. And I'm reading stories from the places that have let up. South Korea, which was admirable in its public health response, then it let up, and people went to nightclubs. Nightclubs? Are you out of your mind? There's a New York Times, we'll talk about a very good super spreading article in the New York Times a couple of days ago, and it reported on cases from Hong Kong. Hong Kong did a good public health job and then kind of reopened, and one guy gave it to 73 people because he went to karaoke bars. Karaoke bars? Yeah, I've been defending human rationality all these years, and
well, the right preferences, that's totally rational, right? So.
But anyway, from a sort of society point of view, I have hope that we don't have to, every single one of us, monitor every detail of our behavior and make sure that every jogger wears a face mask if we can just stop the super spreading activity. So those are the two central things I've learned.
It seems that not only the behavioral model that you're talking about, but this idea of avoiding the heavy tails seems to have started even before all the places were in lockdown. That's again gives me hope on the rationality of people. You see this crashing in mobility data and all sorts of things even prior to governments implementing forced lockdowns. And by the way, to be clear, the forced lockdowns that we have in the US were very different, for example, than the ones we had in Europe. We don't have police yelling at us to go back to our house, thankfully. And I got yelled at a golf course, but walking with my 2.5-year-old son. But beyond that, and we didn't have the draconian real measures and yet the degree of it looks like the reproductive rate of the virus was sort of quickly going to something around 1 from the beginning of the data showing something around 2.5 or so, right?
So airlines, restaurants, mobility data, that's Tom Phillipson at the CEA has been doing a great job of assembling. He's got a bunch of tweets showing private behavior figured this out very quickly. Now that's, as we start to think about the recovery, when are you going to a restaurant again? A nice, a great New York City indoor restaurant with loud, everybody yelling, or even taking an airline flight. When are you going to feel comfortable taking an airline flight? There's in some sense, people can also be too cautious. And as long as the virus is sputtering along, this is another sort of insight I've been thinking about for the last month or so. How much of a recovery we're going to get? Well, those sectors, I just cannot see them coming back as long as this virus is out there and trundling along.
Right. That's definitely. Now, do you have any insight on why it is that we took this fairly radical option as a measure to attack this problem of locking people down across the entire Western world, putting our economies in pause for 2 months or more, given that it seems that that's like the sort of benefit of the doubt on not doing that should be very high, and yet it became it spread like wildfire as the thing to do, if not for one single country that still are doing the reasonable thing and showed us that individual behavior and clipping the tails can avoid a exponential growth of the disease. By the way, to me, that case study is proof that, okay, if you ask people to do the right thing, it's possible to not have the exponential growth. They are trundling, and you're saying what's happening there. They're just keeping this is going to be the slow burn for a while, right?
People do say Sweden does have a higher death rate than other countries, but they achieved that. They made kind of a cost-benefit trade-off about that.
Right. Death rate again is very much associated with the nursing homes, right? I think 70% of deaths in Stockholm were nursing home related. They didn't do a good job protecting those folks. That's the reality.
Now, this is more a political question than an economic question. Certainly, there's lots better economic policies we can think of for doing this. And I'll just give a lighthearted. No political leader has. It's very hard to do too much in a crisis. So the political calculation. Now, why do they start by lying about it and saying, "Oh, it'll go away"? Because you don't want to be the guy who shut down the economy for SARS. But once the public is convinced that this is a big problem, then there's very little political cost to doing too much to solve a big problem, and that's, I think, why they clamp down with the big sledgehammers.
And now it's going to be, as you said, right, a lot of justifying that was a good idea, that policy choice is not a bad one, and you already see that happening. A lot of people claiming causal effects on well, we're supposed to kill 2.5 million people, we kill 100,000 people, so the lockdown saved 2.1 million. So that kind of conversation has already started.
Nobody lost a election, right, for saying, well, if you'd let another 20,000 old folks in nursing homes die, maybe we could have gotten along with 15% unemployment instead of 20% unemployment. That doesn't win an election.
Actually, there's a question. That's a good question. Do you have a sense of whether we're going to be able to try to estimate what would have been? What's the counterfactual here? What if we had done Sweden? How different you think because obviously there'll be a change, there'll be a shock in demand by what you're saying. People's behavior would change, people would not fly, they're not going to cruise ships, et cetera, that has an impact on the economy. Do you have a sense, would you dare putting a number on that counterfactual?
I think let's you're going to be talking to students. Here's a good thesis topic. The part about it is you need to do some pretty detailed micro modeling to figure that out. So like we have a dog. They shut down the dog hair groomer. Why exactly a dog groomer is worth shutting down? So there's an example. If they had said all businesses are shut down except essential businesses and dog grooming businesses, we can figure out, how much more would the virus have spread? 0. And how much GDP would you get out of dog grooming businesses? I think you'd have to make that calculation, along with could even the businesses that remained open. I was shocked at how, like the Amazon workers had to go on strike to get sort of basic stuff imposed at Amazon. So the private sector did a pretty darn good job, but there was, it was interesting how much was going on, and just the idea was, well, we're essential, so it's business as usual. So obviously this could have been done at much, much less economic cost. How much? Good question.
Yes, that's definitely, I hope that at least gives an opportunity to study this, is the difference in time between different states imposing things. But again,
the big lost opportunity, we shouldn't be talking about economic shutdowns at all. The big lost opportunity is in January, a competent public health response. Use the German test, all right? Shut down flights from Europe, flights from China, even if you don't have to shut down the flight. The Chinese were, bless their hearts, they were at least using temperature. They had you go into an airport and there's a video machine that takes everyone's temperature. The TSA just started talking last week about maybe we should get some of those. Hitting this early and hard with standard public health measures is the lost opportunity that we should be promoting.
Do you see any hope of us actually tooling up on that and doing? Again, go back to your point at the beginning of, if we're worrying about these things like climate change, that is 100 years from now potential problem that we have a lot of time to adjust. And by doing so, we don't worry about investing the things that might hit us today. We're not ready when those things happen, right? So right now we have this opportunity, this virus, as you said, was not bad enough to really wipe half of the population out. But one of those could come. Do you have hopes that we're going to create that infrastructure? And because again, there's the state capacity problem, right? We do too many things, and perhaps not too many things that we need to do, and not do them very well. Now, is that
I have to try to remain hopeful and not too cynical about the project of American democracy. I mean, I will echo Paul Romer's got it exactly right. We're spending $7 trillion on sending checks to voters, and we can barely, and then we're fighting about who's going to pay for masks and who's going to pay for testing. $100 billion on test everybody in the damn country that would stop it instantly. We're barely even touching that sort of thing. So, a country who can't do that, do we have still the capacity as a government to undertake long-term reforms? I don't know. We sort of did in response to terrorism. There at least, whether it was successful or not, or useful or not, there was a deep, low-level bureaucratic. We discovered after 9/11 that the cops don't know the phone number of the firemen, who don't know the phone number of the FBI, who can't call the FAA. So let's give everybody the contact list and make sure they know what the phone numbers are. So we did in that instance have the capacity to put together a detailed bureaucratic response. Can we do that again? I hope so. If not, the next one will come and it'll be worse.
All right, so final question. When we're thinking about the long-term consequences, growth associated with this, we already talked about that a bit. And assuming that this is going to be with us for a while until a vaccine is available, how would you evaluate our ability the ability of the private sector in the U.S. in particular? Because I guess I'm asking this question from a pride that I have, that the U.S. economy, the U.S. private sector is just more flexible than the European one, for example. And I think that gives me hope that we'll be able to adjust. We'll be able to adjust a little faster. We'll be able to relocate resources in ways. Would you agree with that? Do you have a general? So we could even think more specifically in this country, inside of the country. Do you think there'll be a different type of recovery in different parts of the country?
Yes. So, boy, this is going to be shown not tomorrow, isn't it? So, making forecasts. So, I want to say at the outset, the economic future is very uncertain, and that's a deep point. I think all of our public policy should be based much more on recognizing the uncertainties of economic forecasts, rather than here's the conditional mean and now we're going to act as if that's certainty. And I do think that, like the military, some scenario planning, bracing for the worst, is as important as making the forecast. So, there's good and bad scenarios out here. A lot of it depends on the disease. If the disease fizzles away quickly, if we do get testing is just a way of reducing the economic cost of getting the reproduction rate below 1. So if we, either by testing or other means, find ways to reduce the economic cost of getting the reproduction rate below 1, and it goes away by the end of fall, I think there's a chance to go back to sort of normal fairly quickly. If not, the downside is that it trundles along, the economy stays depressed, then the financial crisis part of it does hit, and then we're into a recession for a long time. The other dangers, of course, is just how much damage is the government going to do in its efforts here. As much as I feel for people who've lost their jobs, if you pay people more to stay unemployed than to go back to their jobs, they don't go back to their jobs, they don't find new jobs. And there is a big shift in demand going on. So the flexibility you mentioned, we do need to move, people need to move to different kinds of jobs and different kinds of activities. So the US, I guess, yes, as you look at the US, you kind of despair of our lack of flexibility until you look at all the rest of the world, and then you say, things could be a lot worse. Will those shifts happen? And I think there will be some shifts. So first, as long as the costs of dealing with the virus are high, we have a supply shock, and we're going to be trundling along. The good part of that is a lot of the need is for low-skilled workers. So if there is a decently functioning labor market for low-skilled workers, there's a lot of jobs in wiping things down and checking who's got the masks on and contact tracing and so forth. Now we have a singular ability to screw up labor markets, but that's not good GDP. All that stuff, those are low-skilled jobs. And if restaurants have to serve every 2 spots, then restaurants are going to cost twice as much, which means people aren't going to go out that much. And wages for restaurant workers are going to be lower. And that goes around the economy. And there are some worrisome. I still think the debt matters, and what the aftermath, the disincentive aftermaths, and the deficit aftermaths of where we're going. If we respond to this stuff with a whole raft of new both programs and debts that have to be paid off, there's a big economic danger for this lying around for a long time. And the shifts in demand could be pretty huge. Already, cities, I think, were in trouble.
Right.
We've all learned how to do Zoom. As much of a pleasure as it usually is to come to Texas, you and I did this. So the social network fixed costs of Zoom, of online, we've kind of all, well, that's going to change a lot of how businesses do things. Facebook has said half of their employees are going to work from home from now on. Well, that's not great news for the real estate market in Menlo Park. Now, maybe that's a good thing since I'm completely outrageously priced here. Are cities going to survive, I think, is a big question. I know a lot of young tech millennial types who were just, a year ago, oh, I have to live in San Francisco because the bars, the restaurants, the nightlife, and so forth. And now they're all saying, well, I think it's time to move down the peninsula where I can send my kids to a public school. And there are some bars and restaurants, which are, especially after looting, those are going to be, when our business is coming back, and the state and local government finances are an absolute disaster. So that, it may look like, cities may look like a Batman movie for a while. And that would be that's an example of a shift in demand that's going to take a while for the U.S. economy to think about.
Yeah, and it's amazing how quickly, right? Not long ago, we were writing about we should be building more in the city. Cities should just be more dense. We should encourage density. That's the NIMBYs might have won this from completely lucky way. They might have won.
If you're worried about gentrification, well, your worries are over. Although I do want to, I'm going to check you on linguistics. It's not we should allow. Exactly. We should have allowed people to build in cities. We should.
That's right. All right, John, this was great. Thank you so much. And thank you for all the work you do on the Grumpy Economist. I make my students read a lot of things from there. It's incredibly informational for all of us.
Thanks. It's great to talk to you. And I hope all of this doesn't look completely dumb by the fall.
No, hopefully not. All right. Bye.
Bye.